Today on Voice for SME, we'll be going all the way to Lekki to talk to one of the most renowned surgeons in Nigeria. He is a world-class experienced plastic and aesthetic surgeon, skilled in public speaking, team building, as well as leadership building. He is a strongly passionate consultant with a focus in plastic reconstructive and aesthetic surgery from West African College of Surgeons. Dr. Femi is an experienced community mobilizer for healthcare. He is a philanthropist and founder of Kind Heart Nigeria, an organization that is focused on free treatment of cancer patients worldwide. Today on Voice for SME, Dr. Femi will be busting a lot of myth for us and taking us into his world. Let's go together. Good morning, you're welcome to the show, Dr. Femi. I'm so honored to be interviewing you today. All right, so I have a confession. I've always wanted to be a doctor, but it was not a successful ambition. So I'm envious of you, but then, I'm happy with what I do at the same time. So just take us through the journey. How did you decide to become a doctor, most especially, a plastic surgeon? Take us through that journey.
All right. I think doing many things in life, one has to consider passion. When I was young, I think I like to be challenged, honestly. So I felt the only place that would challenge me more. And that also followed me for a while before I decided to now come down on plastic surgery. So I wanted to be challenged, and I felt medicine is probably where I can be challenged. Then when I got in, of course, what is in medicine is more challenging than being a surgeon, than surgery. So I chose surgery too. Do you understand? So as time went by, I also felt that doing neurosurgery is like the highest and the most challenging. But I read Ben Canson's book, and it will sound so awkward. He's a neurosurgeon, and probably maybe because I wanted neurosurgery, he should have reading his book will have probably encouraged me more to do neurosurgery. But he says so many things about what he liked to do. And what made him choose neurosurgery is what he wanted to do. I found that I like to use my hand more. Do you understand? I love using my hand a lot. So I just felt, okay, neurosurgery is braining. Of course, it's surgery, you use your hand also. But for me, being aesthetic, using my hand to make things, I felt it was more of interest to me. So that made me choose plastic surgery. And I think, though it's been very challenging, it was so challenging, then I had to reach this level, but thank God, everything was a build-up until now. Understand? And I chose plastic surgery, and that's why we are here today.
In the last few years, the need for plastic surgery, either for health purposes or for those who actually want to look better, has actually increased exponentially. What do you think the reason for that is, especially in Africa? I mean, other parts of the world, we know people do that a lot, but in Africa, you hear that people are beginning to get comfortable with that idea of actually doing something with their body. What do you think is responsible for that exponential increase?
Wow. Well, I think that's one of the myths we have to actually bust. Do you get? Because, surprisingly, Nigerians have been patronizing this for so long. Yeah, for so long. And like Mr. I would know, like I mentioned sometimes when we're having DBA training, I mentioned the fact that the reason why I actually wanted to start the business like the way they will have seen it abroad is to reduce the body of Nigerians traveling out to go and do it. Because I've been aware for long that Nigerians patronize this. You'll have maybe had an idea of sometime when a lady used to bring surgeons to Nigeria as long as when I was young. Do you understand? And so in the training also, we also know people who go get surgery done abroad. They don't have all the insurance and the facility to be maintained and followed up there. They run back to us, and we face the burden of managing the complications. Wow. Many Nigerians travel abroad to go and die from this surgery. Do you understand? So it's just because maybe now Nigerian media or the people are now beginning to be aware that Nigerians patronize it. Do you understand? So it's been like that for a while. Do you get? And the other thing that I will now say maybe a second reason is the fact that, okay, now that it's here in Nigeria, more people who have wanted to do it, who could not afford going abroad, are now able to afford it because we have made it so. Even though if you go abroad, it's not likely you get a better service than what we offer. And that removes a lot of other burdens on them, traveling with somebody else, having to stay in a hotel, you are not near your home and all sorts, even the cost of traveling and stuff. So that has also increased the fact that, okay, many people do it. Then, the other part to it, which is not peculiar to Nigeria, everywhere in the world, is the fact that, oh, people have models out there they want to look like. And what are some of the journeys those models have gone through? Do you get? And of course, the part of, okay, somebody who wanted to look or is trying to look good, trying to look prettier, and if you don't mind, I'm sure you coming out for this, you are specially prepared, yes, because you know it presents you better. Yeah. Do you understand? So that is also a general need of human being. You want to look good, you want to dress well, and so. And I'm sure maybe as we go along, I'll bust some of the myths that people have concerning plastic surgery. Okay, maybe one of them is, for ages, probably from time unknown, women always want to have a figure. Do you understand? If they don't have it naturally, they will design it by their dress. Mm-hmm. Do you understand? Arts are there that have been ages past that have been discovered recently. And you see the shape of the artist, the shape the artist drew or carved out is a curvy woman. Do you understand? So it's like it's an inbuilt need of human being. And I say human being because the woman is doing it to look so and be happy. And the man also is looking at it and is proud that, oh, this is my wife, or this is my spouse, or this is my person. So it's an inbuilt need of human being.
Well, I have heard that the cost of plastic surgery is not cheap, and it's not for those who have not eaten. So, or you're still looking for food to eat and you want to make changes to your body or any part of your body. So, and even not just those who actually just want to look sexy, but for those who actually have one impairment or disability or another. How do they even come close to actually doing that if the cost of surgery is so expensive? So what would you say about that? Is that true, or people can actually really afford it, or can I afford it if I want to look better?
Yeah. Okay, but I think one of the myths I also maybe want us to set aside is the fact that plastic surgery is not just cosmetic surgery. It's not just aesthetic surgery. Aesthetic surgery is just a very tiny, small part of plastic surgery. Do you understand? Yeah. So we have so many other areas. The plastic surgery covers from head to toe. If anything, we are about the broadest specialty you can think about. Yeah. And I think maybe when I talk about other things, use that also as a means to encourage other people. Plastic surgery is very broad. Unlike most other specialty of surgery that are narrow to certain area, they face certain areas and stuff like that. And that's why you see, anywhere you see a plastic surgeon, is busy all day, all his life. Because every other aspect of surgery need their expertise in one way or the other. You understand? So, where I'm driving at is that even though the cosmetic aspect of plastic surgery may be a bit, it's popular, maybe a bit expensive and all those things, it doesn't mean plastic surgery as a whole is expensive. Do you understand? And then sometimes also what it needs to offer this cosmetic aspect of plastic surgery is quite expensive. Being equipment, facility, the skill. Do you understand? Even acquiring some of those skills are on the top notch. Therefore, that's why the cost is a bit on that side. And also, the reward is a bit maybe better too. Do you understand? Because of most of this investment you have to put in terms of resources and stuff. Take for example now, like yesterday, one of the surgery I had took me 6 hours. I was 6 hours on my leg. Tell me which surgery and how will you have factored that? Even if you have operated surgery, if you have done a surgery on someone, that will cost you that long, standing on your feet. Do you understand? So that's some of the reason. Precision, skill, everything, you input a lot. And if you look at the investment in it in terms of facility and some of the things, that also may be responsible. But now, coming back to the aesthetic surgery and affordability compared to going to other country, the difference is a whole world. Do you understand? Because sometimes somebody who will have gone to US to go and do the same surgery may get here, may pay like maybe times 10 of what you'll have paid. And I can assure you, for what we do, you can hardly get it anywhere better in the world. So why would go waste your money going abroad? Do you understand? So if you look at affordability in comparison to going abroad, it's cheaper here. And then I will not also say that all clients find it so easy to just pay off this service. Some of them build up the fund. And they know that most of the time, by the time they are able to achieve certain level of the fund and they are able to do this surgery, so many things change in their life. A lady called me yesterday, he said, Dr. Femi, I'm the face of, if I call the brand now, you'll be shocked. Wow. I'm the face of this brand now, simply because I had this surgery. She's a professional. Wow. I'm telling you. And she said she was choosing to be the face of that. Simply, I'm sure, because she has become more pretty.
I've had to read a lot of articles, and people have said that a lot of people who had made adjustments to their body one way or the other actually stems from the fact that people have low self-esteem. So what's your opinion about that? Is that true, or is it just a myth?
In a way, I would say no. Okay. Outrightly. It's not as if they have a low self-esteem of themselves. But the fact that they know their morale, their esteem is boosted when they do it. Not everybody who came in for so. In fact, let me tell you, one of the basic things you must do as an aesthetic surgeon is once somebody has low self-esteem, these are the kind of patients you should try to avoid. Do you understand? Because we always let them see we are not God. We are not creating human beings in this place. Do you understand? Even God, who created us, who is most perfect, did not make us so perfect. Do you understand? So who is a surgeon that can make you so perfect? Do you understand? So, we are not God. So if somebody comes because she has low self-esteem, if that is not handled, then handled by whatever means, maybe she may have to see a psychologist, you yourself may have to play the role of a psychologist in boosting the person. Sometimes I'll tell patient, you are so beautiful the way you are. Who says you are not? Do you understand? You are not doing this surgery because you want to be more beautiful or because you have a low self-esteem. Go and think about it. You are this, you are that. Some of them will be shedding tears and be so happy. At the end of the day, they will leave and probably now decide to do it because they actually want to do it, not because they have so low self-esteem.
Okay, so my next question is this. Normally, we believe in Africa that the bigger, the better. I hear African men want it big, front, back, sexy, and all of that. I mean, that reminds me of a popular movie, sometime that I think Two-Face song was played in. This lady that was fat, and then, obviously an African man was interested in her, despite the fact that, people in the West had actually rejected her, body and all that. So he talks about the fact that a lot of people want to look sexy, they want to look fine and all that. But then there's the risk factor too. How safe is it? Because I've read a lot of articles about it. I even heard about a popular case in Nigeria that really, really went bad, and the hospital was sued and all that. So how safe is the process? So as a doctor who has had many years of experience doing this, how would you, tell someone who is actually interested in going through the procedure, but is afraid of the risk that is involved in it? How safe is the process? How safe is the procedure? And would you advise, people to actually still go along with it if they really want to?
Okay. I think that's another myth we should break, because most times once I hear a husband calling and said, my wife has consulted your clinic, and the doctor, what are the risk factors? What I've actually just removed from his mind is that, sir, this has nothing to do with having children. If anything, and I have so many testimonies about this one, if anything, it even enhances it. Yeah. The reason why I say so is that majority of the surgeries people do in cosmetic surgery worldwide is about fat removal, sculpturing using fat, either adding, removing, reshaping, and stuff. When you remove fat from your body, it portrays, and it gives you so much health benefit. The journey is not easy. The journey is very tough. I think I'll come to that on the second aspect of that question. It's very tough. But when you come out of it, it's good health all the way. Research founded this other part of enhancing somebody getting pregnant. I've started to collect data. Because I've had people, I've done several in hundreds. Do you understand? But I can point to like 4 or 5 who had problem having children before, who after doing liposuction, before you know it, they conceive. Wow. Do you understand? Reason being that okay, there's a client that came from UK. She had multiple ovarian cysts. Cysts is when there are like fluid bubbles in the ovary, which can attenuate the ovary and make it not produce egg. You understand? So that could affect childbearing. So she was diagnosed of that. She came in, did lipo. She went back. I don't know what she was doing, and they had to scan her again. Everything had gone. There's no documentation anywhere about this, but at least in her case, it happened. I can tell you, maybe in 5 months to that time, she may conceive. Do you understand? Though she's not among those that I said conceive after not having children for long. High blood pressure, diabetes, those ones have been documented. Really? Yeah. Excess fat in the body, those ones have been documented. Even though liposuction is not about weight loss procedure, it's about fat losing procedure, but subsequent benefit is definitely trimming down and weight loss. It reduces your appetite, it reduces your desire to eat, and every of these things add up and make you become smaller in terms of weight and size. Do you understand? So you become healthier. Now, you become prettier. The guy has refused to let you go. You understand? He's always there. He's always around. Before you know it, pregnancy has entered. Oh God. Do you get? So these are some of the things I am trying to see. Maybe we have to document. Do you get? So now, I'll just tell the man, no. It doesn't have. Even if you see where we work, there are so many layers in the tummy. The ovary and the fallopian tube, they are inside. And we're working under the skin. Do you understand? The other advantage it confers also is somebody who probably had children, the tummy is so big now and stuff. When you remove it, it becomes smaller. When it hardens up and heals, it tightens up the tummy in a way. Do you understand? Not to talk about the tummy talk and the other aspects, but I'm even talking about the common one that people do, the liposuction. The other part is the fact that somebody who has not had anything before, has not had children before, does liposuction. The tummy is firmer. When they are getting pregnant, do you understand? The tummy is so firm that it will not allow the womb to push it forward. The womb would rather be ascending. So the component of forward movement of the womb pushing the tummy is less.
To listen to this part.
Do you understand? It's less. So the component going up will now be more. So you find out that people who have done liposuction before they get pregnant, the distension they result is not that it will never distend. It will still distend for, but distension will not be as much. So the pot belly they get or the whatever they have after won't be as much as if they've not done it. Do you understand? But like I mentioned, the journey is not easy. Do you understand? One of the things is there's blood loss. Every surgery you must lose blood. You understand? A lot of fluid loss. That's why we don't joke with fluid at all. In fact, by the time you see us, the way we walk, sometimes when we don't have anything, we play a lot. But when we have, we walk a lot. It's a lot of us. So we have to, it's like an eagle eye on our patient. Do you understand? So we keep eye on them. We ask them to take a lot of fluid that reduces and then treat their pain. The pain is so intense. Do you understand? Like we grade pain in terms of 0 when you are smiling like me and you are smiling now, and 10 as the worst pain you can ever imagine in this world is about 7 or 8. Do you understand? And that is more. It's also more for people who are bigger, more for, I've begun to also document some information. I realize that younger people, young girls, young ladies tend to withstand this easier than people that are, having children before and others. So they withstand it more, maybe because they are just smarter or whatever, you understand. And then if you do much more, the more the stress, do you understand? Then sometimes people who have poor quality skin, maybe because they bleached before, because they have stretch marks that are bad and all those things, have risk of what we call skin injury. You understand that skin process that can lead to injury. Do you get? And in them, you have to take extra caution to prevent that. That does not rule it out completely, but if you take the extra caution and you are lucky, they may not have it, but they have a higher risk of that. The one that people are afraid of is death. You understand? Somebody can die from any surgery. This actually does not have higher risk than any other surgery. It's just because if somebody dies from this, just like you said, you know, if somebody dies from this, they say, kilo wala. Unlike somebody having children, I say, open be money. Unfortunately, it happen. It's not good that even happen even when you're having children. But the fact is that the mortality rate in this is low. Is very, very, very